Today, the federal government announced new measures that will make the path to permanent residency for international doctors easier. It comes at a time when millions of Canadians don't have access to primary care. Jacqueline Wilson reports.
Nearly 6 million Canadians are without a primary care doctor, according to data from the Canadian Medical Association's Our Care survey, and physicians are feeling the pressure of carrying that workload.
Physician burnout is a very real thing. We hear a lot in the news about significant shortages of anesthesiologists and family doctors, but there's shortages in many other areas.
To help, the federal government is making it easier for international doctors to obtain permanent residence by creating an express entry category for those who have worked here for at least 1 year of the last 3 in a medical field. The government will also reserve 5,000 federal admission spaces for provinces and territories to nominate licensed doctors with job offers starting early next year.
Currently, it's estimated that around 13,000 internationally trained physicians in Canada are not working in their field. The changes announced today will help put their skills to work sooner, close staffing gaps, and provide more support to patients.
In a statement, the province says it welcomes the federal efforts to reduce barriers for foreign-trained physicians as it aligns with their own efforts to increase the number of doctors here. Meanwhile, the NDP plans to introduce a motion at the legislature that will improve workforce recruitment and retention.
There's a crisis in primary care. We have almost 1 million Albertans who don't have a family doctor or a nurse practitioner. And then number two, working with healthcare workers to actually develop a strategy around recruitment and retention. Because one of the reasons why there's a crisis is because a lot of them are leaving.
This is also a concern for Dr. Brian Wurzba, who calls the federal announcement a stopgap measure.
We welcome them, but we also want to ensure that our own young people are able to get into healthcare, those that want to get into healthcare, able to get spots in medical school and residency training programs so that we actually have a really bright future for healthcare long term, and we're not always relying on foreign trained physicians to prop up our system.
Jackie joins us from Sheldon Schumer tonight. So, Jackie, how can Calgarians access a physician if they need one?
Yes, sir. So if one of our viewers is looking for a new doctor, they can actually head to albertafindadoctor.ca, and from there you enter your address, and a map of different locations that are spotting physicians that are accepting new patients will pop up in front of you. From there you can add different preferences and filters, like if you need the office to be wheelchair accessible, or perhaps you have a preference for what gender your physician will be. You can do that there. It's also run by the Primary Care Alberta Network, so if it's easier for people, they are able to find it on the Alberta Health Services website. It'll connect you to that as well. But just once again, if they are looking for a physician, that is albertafindadoctor.ca. Tara?
Okay, Jackie, thank you.